there a maximum number of nights that a patient is in the hospital under the observation status?
Honestly, no. But what Medicare will cover, yes. Typically, they're only going to cover about 48 hours worth of care. Because here's what Medicare tells the hospitals of the world. Really, you should be able to figure it out if you're going to admit them within 2 days. Now, there's some outlying things there. X-ray machine falls down, generator goes out, hurricane comes in, something, right? There's some, but by and large, now this doesn't always happen though, because medicine, it's not, there's a lot still known about medicine. So occasionally it might take, we may go down the doc may go down the wrong road, hunting, or we may rule out. They're going to rule out things that are going to kill you first. Well, that's not that, and it's not that, and not that. So now what are we going to do? Okay, well, let's go here. That testing can go a little while, but typically Medicare says you should be able to figure it out within 2 days.
We've had residents that spend 4 to 5 nights in the hospital in the observation status. It just made no sense because our thought was also the same. Shouldn't they be able to kind of figure it out in 48?
Yep, and that's what Medicare wants. That's what Medicare says. Well, they typically will not even pay for services past 48 hours. You got to go through you got to go through all these hoops and all these codes to get past 48 hours. So chances are you probably are not going to get billed for any co-pays past 48 hours. Not in this area. I can't speak for hospital in Kentucky or wherever. I don't know. No idea. But here, typically,
you have to use that chart.
yeah. Yep. So you gotta figure it out, right? Plus, you don't want to be sitting there any longer than you have to. So the idea is, everybody knows your charges are going up. We need to get you through the system and find out what's going on with you. It's a care issue because if you really need this, right? We want to get you from here to here quick. We don't want you. If we got some. Let's say we're looking and we didn't have specific tests and you're really having a heart attack. Well, we don't want to wait 48 hours to get you here. We want to find out as fast as we can. Everybody, the doctors do, you do, everybody wants to find out. You need this, and we need to get this to you. You need to get you in there as fast as you can if you need it. So there's inherent, we need to figure it out and get you, if you need this, get you up there.
Dexter, can I just clarify that point? I'm sorry.
Yeah.
When you say you're going to have to eat it, meaning the hospital, after 48 hours, the hospital has to eat those costs rather than the patient?
Yep. It takes, Medicare will not cover, they can do it. I'm not going to sit here and say it's not, because let's say in your case, and I don't know how long ago, but let's just say we couldn't figure out what was going on. Well, do we really know, or do we not, or do we know? There's some rare instances where it'll occur, but by Medicare's billing, you can bill to 48 hours for observation care. After that, you've got to put specific codes and reasons on the bill. You can't even send a bill to Medicare past 48 hours without doing all these extra steps. So it's difficult. Yeah.
So if you're in observation, you're considered an outpatient?
Exactly. You're an outpatient getting observation services. And why? So the attending can decide if they need to send you home, send you somewhere else, or admit you. Let's do these tests and find out, do you need to really be up there, and what do you need? You need to be an inpatient. If not, where else can you go? You get it at home, you get here, wherever, yeah.
Within 24 hours, you know if it's life-threatening or not. So you
Oh, yeah.
can sign out.
Pardon me?
You can just sign them out of the hospital.
You could sign out, yeah.
Because if you're waiting for x-rays, you're waiting for x-rays.
You can sign out, but I would, I'm not going to tell you, don't get caught up on the 20% here. Think about your health first. I'm not going to sit here and tell you to go run out of the hospital when you could have something that's going to be very detrimental to you. You understand what I'm saying? So it's your right. We have people do it. You'll have people sign out. They don't want to stay for whatever reason. It might not be here. We have people in inpatient that They sign out. They don't want to be in the hospital. It happens. But your physician's going to tell you, look, if you leave now, you're taking some risks. It's your right. Sign out and go, but it's your right. So be cautious. Take care of yourself first. Take care of yourself, and then worry about the 20% later. That'd be my advice. Yep.
Dexter, if a patient spends 2 days in observation and then is in fact admitted to inpatient status, the 2 days of observation, does it like retro back, and do those first 2 days count as part of the inpatient stay, or it only starts after the 2 days of observation?
That's a good question. So
And that's now day one.
Yeah, so let's, you all into my slides now. All right, there's no going back for Medicare, okay? So if patient was in 2 days of observation and they finally found out, oh gee, now we know the problem is we're bleeding over here under the spleen. We need to do surgery. You're going to become an inpatient. But your claim, your hospitalization can't be part outpatient, part inpatient. It's one or the other. Does that make sense? So if you're in observation, like a question, for 2 days, and then they find out, oh, now we found the problem. There's a little bleeder under here. We need to go to surgery. We need to be inpatient. Your entire stay is inpatient. However, we're still going to get to your SNF rule here in just a second. So you'd be an inpatient. You wouldn't have 20%. You'd have your big deductible unless you'd already met it, $1,200. If you'd already met it, it would be no cost to you. So your stay there, inpatient. You can't be part in, part out. That doesn't work. You're either an outpatient with observation services or you're an inpatient. One or the other.
You can't have 2 days of observation and 2 days of outpatient and 7 days of inpatient.
Literally, that's what you'll have, but your whole claim will be considered an inpatient. Does that make sense? You can't, there's no, Medicare doesn't say you get to bill here and here. Once you become an inpatient, that you get one payment for that. So you can't go down and bill this too. That's included. If you become an inpatient, it all just gets wrapped up into your inpatient.
Which also qualifies you for rehab.
Also qualifies for your rehab. So let's get to that. All right, a couple things to keep in mind. Being placed in the bed does not mean, right? That's huge. That is the biggest misconception, other than the SNF rehab piece, that's plaguing this country and the misinformation. So we got that. We beat that one to death. Ask your status. If you missed, let's say you missed it when you signed in, because it happens. You're in a hurry and they're telling you, and your family member's sick and you're trying to get going. If you're in doubt, ask. Okay? Ask for a case manager. It's case management. You are discharge planning. Ask for case manager. If you have to ask your nurse, they can help you, give you information, do the same thing I'm doing, sit down and talk to you about it, explain it to you.
In that case, who is your case manager?
I've got 40 some odd that work in the department, both here and there. So you have one case manager and a social worker assigned to practically every floor, here and north. So there's somebody there. So there's even somebody there on the weekends. Okay, so if you're in doubt, ask for a case manager.